producers, you might wonder what Nurse Haley is doing on my stomach, but I have these deep horizontal lines that I've had ever since I was a child, and over the years I noticed that they're getting deeper and deeper, and that comes from chronic just sitting and flexing motions with your stomach. And I'm at a point where if I can regenerate that tissue that has been chronically folded and it has destroyed my collagen essentially in those creases, why not stimulate the skin back to be thicker and stronger? So that's exactly what I'm doing here with Nurse Haley. She is injecting PRF. It's a natural collagen stimulator that is derived from your own blood. So the way that this works is we draw your blood, we put it in a centrifuge, we heat it up, and then we cool it down. This is also known as easy gel, where it literally forms a gel-like consistency that is superior than the standard PRF because it stays in the skin longer. What does that mean? It means that you have a slower release of growth factors over the next month to 3 months, and you only need 2 treatments instead of 3. So I really like how aesthetics is going towards these collagen stimulators and regenerative medicine, stem cell therapy, just because filler is not the end-all be-all for every area. If I were to put a hyaluronic acid-based filler in my stomach lines, which I have tried before, it just doesn't look right. And the reason why is that chronic folding and flexion of the stomach lines makes the filler kind of blob up and look lumpy and bumpy. So this is really my only option. You can also do microneedling, which I might do later today. And there are some laser devices that can help with skin tightening, but in terms of remodeling the tissue, it takes a lot of series of treatments for lasers and it's really painful. So this is really quick. I'm chilling. I have a very low pain tolerance. Nurse Haley knows that. So it's very doable. And the reason why we wanted to show this to you guys is that PRF is not limited to the face. You can do it on the body. This is actually originated from dentists, in case you want to know the history. When people used to get dental implants, dentists would put PRF to help that tissue regrow and allow the implant to hang on to that tooth a little bit better, more stability, and just kind of regenerate the circulation there as well. Athletes use this in their shoulders, their knees, their ankles after injuries. So there's been a lot of great evidence about plasma and PRP, PRF. So I really like the science behind it, and it's your own juice. So you can't go wrong with it. There's no side effects. Typically after the procedure, you're gonna look a little lumpy and bumpy, and that's fine because just remember your skin absorbs the PRF, and the benefits is the growth factor release, not the actual immediate result. You'll notice that your skin quality gets better at the 1 month mark. Day 28 and beyond is when you start to regenerate the collagen. And the aftercare is just really keeping it clean. Try to stay away from makeup application for the next 4 to 6 hours. And the bruising will also resolve if you have a couple of pinpoint bruising. And this is completely safe for patients who are pregnant or breastfeeding or even postpartum and just want to help regenerate the skin quality around their stomachs. This is also great for hair loss. We inject it into the scalp to regenerate the hair follicle that's getting weaker with thinning hair, and it's a beautiful treatment for those who don't want to undergo hair transplant. Those are very pricey, those are very painful. So if you're in the age between 30s, 40s, your stem cells are pretty healthy. So that's a really good age to start PRF injections into the scalp. So what you're gonna see me do is PRF under the eyes. I love this for myself. I've actually tried filler under my eye, and just like other patients, it doesn't always settle well. And the reason why is because there's a circular muscle that encompasses the eye below called the orbicularis oculi muscle that is essentially like a sphincter-like muscle. So when you smile and relax, the filler that's very deep underneath the eye, that's how it should be placed, eventually kind of pushes forward because of that chronic muscle movement. So by putting PRF, growth factors, I'm helping regenerate my under eyelid skin instead of putting filler, and it's just more natural. There's no chance of migration, no chance of adverse events. So let's do this. I do this about once a month for 2 times, and I'll do this about maybe 2 times a year. But for the average patient, just once a month, 2 times for 1 year. I am making my pilot hole, and that is where the cannula, which is not a needle, I know it looks like a long needle, will glide under. See how it's a blunt tip? That is exactly how it is inserted, so there's no chance of excess swelling, bruising, or shearing and trauma of the tissue. And I'm tapping because it helps me not feel a lot of the tugging of the cannula. Okay, so now I'm underneath my tear trough, and I'm gonna go ahead and start injecting my own PRF. And for those of you wondering what PRF actually looks like, it literally looks like kind of like fat, this gelatinous material, and this is why it stays under the skin longer than traditional PRF. And now I moved on to microneedling. I am doing my horizontal neckline. They are not too deep, but I just want to make sure that I'm resurfacing it so that way I can stimulate that collagen, help the lines look a lot less apparent, and more importantly, the skin to be tighter. This also helps the appearance of what's called chicken skin, where it has these superficial bumps. You can also do what's called micro Botox to the skin to improve the skin quality and texture, which I will be doing on myself next week. And a lot of people always ask me, why do you get so red during the procedure? And the answer is actually a few different reasons. One, we put on a topical anesthetic called lidocaine. Because lidocaine is a vasodilator, you are naturally going to get pink. Secondly, we put your own plasma, which means your own blood product on your face. Sometimes this has red blood cells that are in it, so you will look red because your own blood is being smeared. Thirdly, it's because we are causing some controlled trauma with 13 little microneedles at the end of this tip that's vibrating in and out to a level of depth that I control it. So because of those 3 factors, you turn red, but it does not mean it's painful. You've seen me inject PRF underneath my eye, and now I'm gonna microneedle it over my eye for that extra collagen stimulation, but again, more importantly, for skin tightening. I actually love this for when I have these deep, dark pores that just will not get extracted no matter how much manual pressure I apply, which I know you shouldn't be doing because you can hyperpigment like this guy I did. So microneedling just opens up the pores, helps with congestion, especially ones on your nose. And yes, I expressed this one as naughty, which is a perfect time for me to do microneedling.